Alright, welcome back to the exam walkthrough audio companion. This is page 4. Urinalysis testing is testing for specific gravity, protein, blood, and glucose. Specific gravity, protein, blood, and glucose. Just those 4 things. You cannot certify a driver who has not provided a urine specimen. Plain and simple. They can't pee, they can't get certified. Bottom line. Gets even more interesting when we talk about drug testing, which we won't do in this course. Just know for the basic exam, the specific gravity, protein, blood, and glucose are the 4 things you're looking at. Just those 4. Are there any maximum or minimum height and weight requirements for drivers? No, not at this time. There is not. There are other things like the neck circumference, which we use to help evaluate drivers, and that's also something along with BMI that we look at when we're considering the risk of sleep apnea and such. Okay, what if you're making comments about a certain system? Use the system number. That's probably the easiest way to discuss it. So you're going to use the number as listed in the report to signify that that's what your comment is addressing. If the patient or the driver has Meniere's disease, do not certify. Meniere's disease, not qualified. What about vertigo? You're going to disqualify any uncontrolled vertigo, but BPPV, or benign positional paroxysmal vertigo, or peripheral vestibulopathy, that can be certified if the patient, the driver, is symptom-free for 2 months. BPPV, or peripheral vestibulopathy, can be certified if the driver is symptom-free for 2 months. However, labyrinthine fistulas, or non-functioning labyrinths are disqualifying. Plain and simple. Labyrinthine fistula or non-functioning labyrinth are disqualifying. Even if the driver has a disqualifying condition, you must complete the exam to determine if the driver has any other disqualifying conditions. So the important key here is, even if you know the driver's not going to be qualified, you finish the exam so you can see if there's any other elements that need to be addressed. So just because the blood pressure is out of control, you still need to look and make sure their eyes are going to pass, the visual acuity portion, and the field of vision, all those things. You need to listen to their heart and do the full exam, because you might hear a murmur. All these things then you can capture and let them go out and basically do their homework in getting all this information back to you. If you do one at a time, you're going to have a driver very upset with you, not to mention they'll run out of time. Because they have the 45-day window, they're going to need that time. For more information about the other products we provide regarding the DOT exam, in other words, the NRCME, please go to our website and purchase our products there. Thank you for your support.